PET scans, they are a way for us to use nuclear chemistry in radiology or technology program in classes that I teach, that it supports this understanding that we use the positron emission tomography to scan and to go pass through. It's nothing but a chemical reaction that takes place any given time, any given space, any given place in the world. And it's just a way to focus these energies and to see things vividly, such as tumors, and to certain kind of organs like livers, kidneys, cerebellum, and those kind of points. If we can see things earlier, we can treat them earlier and have a better outcome for life.
In conventional PET scans, the exposure to radiation is considered low and safe.
There's a time delay in how long it is in the body. That's partly the window we use to see it in the brain, but these are things that should be excreted out, and so there's been studies where they've followed it over time, and so it's a certain time window of where it exits through the urine, and part of that hydration is to help that process.
The procedure is completely painless. Some people might feel like it might be uncomfortable to lie down for a long amount of time, and you will be given a blanket and a pillow under your legs to be able to get more comfortable. Some people even fall asleep during the procedure. That's how comfortable it is for some people.
We generally do not want to use sedation for these types of studies, particularly on the research side. There's risks involved with sedation. For some scans, like the glucose PET scan where we're measuring brain energy, we actually don't want to sedate someone because it can mess with the scan results. So yeah, we don't generally use any sedation for these types of scans.
A PET scan is not a diagnosis per se. A clinician will be gathering that information and other information to get the full picture of what's happening. PET scans within research will help us understand how the brain works, how Alzheimer's disease works, and ultimately will help us create interventions and treatments to cure Alzheimer's or prevent it.
We tend to have a pretty homogeneous group, and that's something that needs to change, because if we do find something that seems to be helpful, or if we're learning new information, but how generalizable is that to our patient population?
I had no pain, no discomfort. It was very easy. I just would encourage anybody who has reservations to look beyond that, and ask the questions that they have. Because the technicians are very helpful and very knowledgeable.